I'm Belinda Lennox. I'm a consultant psychiatrist and clinical senior lecturer in the Department of Psychiatry at the University of Oxford, and I'm one of the clinical leads for the early intervention in mental health theme for the Oxford AHSN. The main age of onset of almost all serious mental illnesses is in late adolescence. So 75% of mental illness will start before the age of 24. So this is at a peak time when young people are usually leaving home or entering higher education or getting jobs. So it's a really important time for both social and occupational functioning. So having a serious mental illness at this age really has the potential to have derail a young person's life, and that's why it's so key to intervene early. So in mental health, early intervention has been based on the finding that the earlier that you treat somebody with serious mental illness, the better their long-term functioning and their long-term outcomes. And for the last 12 years or so, we've had a program of early intervention in psychosis, disorders like schizophrenia and bipolar disorder, which have shown that they can improve people's health in the long term and can save money for the health service because people are less likely to need ongoing help after help from an early intervention service. So our plan is to implement early intervention both in psychosis but across other mental illnesses as well. So we're going to do three things as part of our network in early intervention. First of all, we're going to make sure that the best practice of early intervention in psychosis is implemented across the region up to the highest standards. The second thing we're going to do is make available the cutting-edge research that is going on in the region and also nationally. We're going to make that available to every young person involved in mental health services across the AHSN. And the third thing we're going to do is look to extend early intervention to other mental illnesses. And the main targets that we're going to start with are eating disorders, so anorexia and bulimia, to autistic spectrum conditions, and also personality disorders. So the main difficulty with the services as they're currently structured is that there are separate services for young people under the age of 18 and then a separate service for those above the age of 18. And they often have different service structures, different ways of working, different entry criteria even. And all of these major mental illnesses that we're talking about have their onset at around this age in late adolescence. So you can see that this transition between different services really doesn't serve young people very well at all. So a main achievement that young people will notice through the introduction of early intervention services will be a streamlined approach across this age divide so that young people will get one way of delivering services and a continuity of care. So the outcomes from the service level will be an increase in numbers of young people being detected and treated within an early intervention service, and then in the longer term, a reduction in the need for repeated admissions to hospital or ongoing use of services. But that is a sort of a long-term ambition of the early intervention network.